Afternoon, everyone. It's 101 Central Time, and this is a support call for hospices and home health throughout Louisiana and Mississippi. I want to let you know that this session is being recorded so that we will have it available for those folks who may either come in late today or who couldn't join us. I'm very, very happy to introduce our guest speaker today, Mr. Edward Ted Kennedy. For those of you who don't know Ted, you may know his famous wife, who was with NHPCO for many, many years, Jennifer Kennedy, and is now with CHAP. So, Ted, your famous wife introduced you to us, and I appreciate you being able to be with us today and to share some of your expertise with regards to emergency management. The folks on today's call are doing emergency management throughout Louisiana and Mississippi. So, with that, I'm going to unshare my screen and allow you to take over so that you can give us those insights straight from Washington. Thank you.
Great, and thank you, Jamie. I've known Jamie for many years, not only as a professional colleague, but a dear friend, and I am most appreciative of all the things he's done for Mississippi and Louisiana, and happy to support in any way I ever can. Let me see if I can share my screen effectively. Oh, it says someone else is sharing, so you've got to stop yours first.
I did stop. No,
Huh.
no, yeah, I stopped sharing.
Not letting me do it yet. Let's see.
Let me,
And we still see your screen.
you still see my screen? Oh, I'm
I
sorry.
still see your screen. There we go. Winner.
I am very sorry. I thought
No
I hit
worries.
me and technology is not always a good idea.
All right. Speaking of technology challenge, let's see. All right. Do we have a winner?
Yes.
Beautiful.
You may want to hit that little
big.
hit that
You don't want
little
to read
button.
my email.
Right, exactly.
I can make this extra.
There you
Is
go.
that
Yes,
visible
sir.
for everyone?
Now you're on.
Beautiful. All right, thanks. Welcome. And I am again so happy that Jamie invited me in to do this. I love spreading the gospel of disaster preparedness, as we say. I've been doing this a very long time. My first storm was Typhoon Pansangwa in Guam back in I don't even remember what year. I believe it began with a 1.9 though, so it's been a long time. So let's jump on in and talk about a few things. We're going to talk about preparedness planning, some of the, I'll call them tricks of the trade, things I've learned from other people. Let's just talk about it. So first of all, disclaimers, all the usual legal things. Anything I say is untrue, no, and I disavow any of it, and this tape will self-destruct in a few seconds. I am a federal responder. I've been doing this with the feds for a very long time, and so yes, I come at it from a federal perspective, but it's really all the same. When you look at it, the things we're looking at are the exact same things that the states are looking at, the exact same things that the counties and parishes are looking at, and even the locals. This is kind of our spectrum right now of all the resources we have and all of the things. If you look over on that far left, there is always some sort of infected food out there. Chipotle still in business, so those things still happen. But these are the things that we deal with every day, and it goes all the way through the spectrum up through the disasters, and we have resources for all of them. This is kind of where you live, and it's really in that outpatient care and the skilled nursing, and so it's home care and some inpatient facilities. Those are your slice of the spectrum. So that's what we're going to talk about today. And forgive me, I've just got diagnosed with COVID a couple of days ago, so my voice is a little gravelly. but my brain may be a little foggy, so please forgive me if I wander once in a while. But I did not want to cancel this appointment, and thank goodness for Paxlovid. I feel so much better than I thought I would right now. So we're going to talk about disaster preparedness, some of the resources and tools that may be available and helpful to you, and like I said, a few tricks along the way. It's really all about resiliency. It's can you take a punch? Can you survive to keep providing your services, and can you get back on your feet right away? And that's the overall goal. It's preparing for the very inevitable disaster that's going to happen, and being able to withstand it as best you can, and come back and provide services for all those people who need it. You've all seen the CMS rule. You know what it's all about, and there are a few big pieces on there. One, have a plan. Good idea. Develop your policies, etc. The biggest piece is communication. I like to say coordination, which you cannot do without communication. So they are intertwined. But as I teach many classes in disaster response, I tell everybody that excluding COVID, which was the first time that I remember we ever ran out of stuff. There just wasn't any PPE, masks, gloves, etc. And but other than that, every single disaster I've ever worked, floods, fires, hurricanes, earthquakes, etc. It's not about the lack of stuff. It's really about coordination and what we say is the logistics, is supply of getting things there. If you can coordinate the right message and get the stuff to where it needs to be, you can beat any disaster. So that's in the CMS rule, they talk about communication, but in my mind, it's really in coordination, which requires that communication. Let's jump on in. Know your risks. In Louisiana and Mississippi, you may not have to worry about blizzards, but you do still have to worry about ice and snow. And a little tiny bit of ice causes a big problem. So know those things, but know your most likely risks. Hurricane, of course, is the obvious one. But are you near a nuclear plant? Are you, the things, look at all of your risks in your agents, in your areas. Know your risks, learn them. And I'm going to say this over and over and over. Don't do this by yourself. Find out what other organizations are looking at. I mentioned that nuclear power plant. If you happen to be near one, they have an incredible, I guarantee you, they have an incredible disaster response plan because they're required to by Department of Energy and our Nuclear Regulatory Commission. And they're very detailed and they're very good, and they will share parts of it. But if you want to know about the risks, they've already done the risks analysis for your location or for your area. So you can borrow, steal liberally, take from anyone. As I mentioned here earlier, communication has to be part of it. And you really have to look at this from an all hazards perspective. I'm going to talk quite a bit about that in the next couple of slides. In the 2017 hurricane season, if you all remember that one, that was Harvey, Irma, and Maria. FEMA had a heck of a time getting resources to Puerto Rico specifically. And so we came up with a new approach, and it was really, and that's what they call it, the FEMA Lifelines approach. And the essence of this, and I work very closely with them on this, the essence of this plan is to think about all the subcomponents of everything that has to do with all the different commodities. I know that's kind of gobbledygook. That doesn't make sense. It will in a second. Healthcare entities, whether it be a hospital, home care, or inpatient facilities, are not only healthcare things. It's you have to look beyond the healthcare. Every healthcare facility requires non-healthcare things like power, water, transportation, communication, all of those things. And when you look at it that way, you can develop a matrix that helps people make decisions. In the FEMA case in 2017, we literally were all screaming at the FEMA administrator, You had one plane going into Puerto Rico today. I need my stuff on that plane so I can save lives. And so me as the healthcare guy were yelling at the FEMA administrator. The power guys were, the security people were, everybody. And he had to figure out which stuff do I put on that one plane that's going today. So when we looked at it, we said, well, the water systems are down. And the biggest thing the water systems need is power. And the healthcare systems are down. And the biggest things the healthcare systems need is power and water. And we went through the entire matrix and we found out, hey, if you fix power, then you're probably going to fix most of those capabilities. And so power was actually the one thing that was the most important to put on that plane today, things that could restore the power grid. So from our perspective, we have to look at that. I think it's on the next slide, but here, just if you can't see that clearly, all the different lifelines or the capabilities are security, food, water, and shelter, health and medical, obviously, power, communications, transportation, hazardous materials, which sometimes affects us and not, and water systems, or think of utilities. When it comes down to healthcare, as I mentioned, a healthcare entity is not healthcare alone. It requires, I'll speak for hospitals here for a moment, and that's hospitals are not hospitals if they have no power and no water. They are the two biggest consuming items that a hospital needs. And if you have no water or no power, you have no hospital. And that's true of any healthcare entity. If you have no power and no water, it makes it very, very difficult to practice healthcare in a home setting or anywhere else. If you have no communication, you may have all the best docs, nurses, and techs and paramedics out there in the world, but if you have no communication, you are not an effective organization. Same with transportation, especially in the home care world. If you cannot get your nurses and techs to a facility, you're dead in the water. You have nothing. So these are the things that we should be part of your planning, the non-healthcare things that are most important to make your healthcare operation work. Hopefully this all kind of makes sense. Let's keep going. So when it comes to planning, and you've already been engaged in this in a few years, the one thing I could say is steal liberally. This is not school. Copy everybody's work. Look for anything you can take from anyone else, and it's perfectly legitimate, legal, and even encouraged, because your community has already been engaged in mandated, because if they're taking any grant monies and things like that, they've had plans, exercises, training programs for many years. There's no reason for you to recreate the wheel, steal from their materials. And I'll say this over and over. Steal from everybody, your local fire department, your local utility companies, other healthcare facilities, anybody in the system or out. And most people will be more than happy to share these things. I often, for many years, I worked a lot of special events, things like the State of the Union, the Republican and Democratic national conventions, where the papal visits, whenever those things would happen. And whenever a city was announced that says, oh, the convention this year is going to be in Indianapolis, the first thing I did is got those people in touch with the people who did it last time and steal all their work. So that is my my lesson is steal from everybody you can, and I mean steal in the most lighthearted way. It's, imitation is the best form of flattery. So please do it. Here are some of the rules. You are not in this alone. If you try to do anything by yourself, you're doing it wrong. It is a team sport. You have to do this with other people. And we had a problem. I shouldn't tell too many stories, but I will tell a couple of them. For the Republican National Convention in Cleveland a few years ago, Cleveland Healthcare Clinic had a great plan all by themselves. Cleveland Public Health had a good plan all by itself. The county had a plan. The state had a plan, but nobody coordinated any of their plans, and none of it worked. We had to sit down with them. It was actually right about 100 days before the convention was about to be there. and put the fear of God in them and say, if you do not coordinate all these plans together, you're going to fail. And we got their attention. And it was fun. I was the lead off hitter, and I came up and said, I've worked 5 rounds of conventions. You're the worst I've ever seen, and kind of scared them and got them to that point where you have to do this with everybody else. Do not do this alone. Do this with other entities in your community. And we'll talk a little bit more about that. I do stress this bullet that it's really about the relationships, coordination, and communication, because if you get those things done, you'll have help. And get to do this on a Blue Sky Tuesday. Meet people, develop those relationships now, because you don't want to be, as we say, exchanging business cards at the disaster site. All right. I've talked a little bit about this, and you see it in the rule. So have your plan, set your objectives. The biggest things you can really emphasize is supplies, and work with your vendors. Just-in-time supply is great until it isn't. So know what your vendors plan to do in their emergency. What's their emergency plan for delivery of materials to you and your staff, and your patients? Because if you don't have them, bad things happen. One other thing to note is, in those relationships that you're building, make sure you get to know your area emergency managers. And if you can get access to their site, if they'll give you a seat at the table in their emergency operations center, beautiful, because you get a voice at the table and you get your concerns noted. Excuse me. Mutual aid is great, especially when it comes to if you're part of a network. Chances are your entire network is not going to be affected. So if you have a facility in Gulfport and one in Jackson, you may be able to borrow some resources or support from any of those. Same is true with both Baton Rouge and New Orleans may not be affected by the same thing. So if you're part of a healthcare system, you can borrow from other resources within your system, or you can develop supporting relationships with other facilities. One thing I do want to note is electronic healthcare records are very important. It's great to have redundant servers, but don't put the redundant servers in the same room on the same floor, because if it floods, both systems go down. Have a redundant system somewhere else. Let me see what else. Checklist and policies that are easy to access. I used to love, I'm an old guy, so back in the day, we used to have index cards laminated on the back of your ID that you'd wear around your neck. So in a disaster, you pulled up the little index card and it told you what to do, who to contact, where to go, all of those things. Nowadays, you could do that in a phone app, but put your policies, your guides, your procedures somewhere where your staff can access them easily. And the last thing I do want to mention, I already talked about logistics, and that is your volunteer mobilization. If you don't have volunteers, nurture those relationships. We'll talk a little bit about that in a little bit. Excuse me. And if security is a concern, especially providing home care, develop those relationships as well, and let some entity, whether it's local law enforcement or other, know what your needs will be, and they are there to support. All right. Other thing should be in your plan is patient tracking. Have a means to know where your patients are going. And if that means just talking to them and saying, in a disaster, where do you plan on going? If you have to evacuate, where are you going? To the local shelter? You're going to Aunt Tilly's? Where are you heading, so that we can track you and contact you, and do that through your patients, their caregivers, their families, etc. I'm not going to talk too much about this material, except for, your job is to protect your patients, protect your staff, and continue to provide service to whatever degree you can. Let's see, what else? Okay, I've said this enough already, but I want to stress this. Develop those networks. Do this. There is no such thing as a bad partner. Partner with anyone you possibly can. Here's one of my favorite little bits, and that's on the right side. Develop some of those creative partnerships. In Mississippi and Louisiana, especially in some areas, you may need to partner up with a four-wheel drive club who may get your staff to where they need to go, or maybe shallow water boat owners. And this is beautiful. Literally, you can develop a relationship with some of these clubs or groups by buying them ball caps or hats that say, that they are now the rescue crew for, St. Ignatius Hospice. Just for the price of a patch or a ball cap, you get a support relationship where these people will help your staff get to where they need to go. So be creative in your relationships. Anything else on there that's important that I haven't covered? I don't think so. Here's something that's well of note. Excuse me. I am literally drinking pots of tea every day. All right. No healthcare organizations compete on preparedness. It's not something you put on your posters or brochures that we have the highest preparedness. Nobody cares. It's not something patients use as a determining factor. So there's no reason why we cannot cooperate in these areas. I know I'm going to talk about this. Well, I'll talk about it here. Why not? I think, now you tell me, I don't know. The grocery store, HEB, that's all over Texas. Has it made its way to either Louisiana or Mississippi? Are you familiar with them? They're a really good grocery chain, very heavy into Texas, but they have spread out there, even in Mexico now.
What's the name?
HEB, 3 letters.
I don't think I know they're not
They
in
didn't make it
South Louisiana.
to Louisiana yet? Okay.
Not that
They're
I'm aware
all
of.
over Texas.
I'm not aware of them in Louisiana or in Mississippi, but folks on today's call may be familiar with them. If
Yeah,
anybody
they
knows
are.
HEB, speak up.
Yeah, they are the grocery chain in Texas and a few surrounding states. I know, like I said, I know they've gone in even into Mexico, New Mexico, Arizona, etc. They have an amazing emergency management plan. When the disaster strikes, they have feeding trucks, they have mobile pharmacies, etc. I know their disaster manager really well, and he's the first one who really introduced me to this concept of we do not compete in disasters. He literally gets on the phone with CVS and Rite Aid and all the other pharmacies and says, what can we do to support the people in our area? If you open up this store, I will not open up the store right across the street. I'll put my efforts in opening up a store in a different neighborhood. And they literally cooperate on when they can open stores to get the best service and the most service to the most people in the community. And again, it's cooperation. It is they cooperate and coordinate their efforts to serve the community rather than just look at competing with each other during a disaster. And it's a beautiful concept, and it's the lesson learned is we can talk to our competitors and coordinate response with them, and it works. Cool. All right, let's talk about some of the tools and resources out there. My good friend, Kristen Finney, is the patron saint of the Empower program. She started this, her and I have been talking about it for many years, and she's the one who did all the work and cracked the nuts to make it happen. But the Empower program, I think some of you may be familiar with. Essentially, it captures all the CMS data and makes it useful for emergency management personnel and public health. This is a snapshot of Blue Sky Tuesday data for Baton Rouge. And the key things here is, the key takeaways, I'm going to throw a bunch of numbers, but the key things to know is we have the data. It's CMS only, but remember, the slice of the pie for all the insurance world, CMS is a very big slice, and all the other private insurers are smaller. So if you capture the CMS data, you've got a pretty good snapshot of what the entire community is like. And this snapshot of data shows not only who's on durable medical equipment, but you can combine those things. Who's on durable medical equipment plus has oxygen needs, who has home health care services and has durable medical equipment. You can slice the data however you want for your purposes. A little side note, when she created this program, she purposely made the data available only to public health departments, not to emergency management departments, for a very specific reason. And that was the ulterior motive, was to make sure that public health gets involved in the response. So the emergency managers can't exclude them. They have to go to the public health to gather this information. And that way public health gets more involved in the response, and it's a more collaborative effort. So good on her. She did it. She was smart in that one. That way emergency management has to coordinate with public health at that level. This data goes to the state. It can get parsed out to parishes, counties, etc. And some of it, of course, it's available on dashboards that you can get. So like I said, this is, we just took one snapshot here for Baton Rouge, and you can slice up the data any way you want. How many people are on dialysis services, how many people are on dialysis services plus have an electric bed, you know, whatever, however you want to slice the data, it's there. And we did the exact same thing. Actually, I'm going to do that. We did the exact same thing for Mississippi. This is the county for Jackson. So this is Hinds County, and slice the data. You'll have these slides, obviously, and you can look at what the snapshot was for a Blue Sky Tuesday. But as mentioned, we in ASPR, which is we just changed our name. We used to be Assistant Secretary for Preparedness and Response. Now we are the Administration for Strategic Preparedness and Response. We kept the acronyms because we already bought the t-shirts and didn't want to change. So we provide the data. We work with CMS, provide it to the state public health agencies, and then they can parse it out as needed. It has many different uses in preparedness. It helps with planning. In response, it helps power companies prioritize where to put power restoration, etc. All right, and I mentioned we have the data here from Mississippi in the same slices. And this is a piece that we did want to mention here, and that is, actually, I think it's on the next slide, but here you'll have this information. Here's where the resources are for the different things you can gather from the Empower program. And here it breaks it all out, that there is some training, there's some fact sheets, etc. And I think the most exciting thing is the piece I want to get to here. Here's the training. Oh, the DME, replacement of DME. If one of your patients has DME and they are a CMS beneficiary, the number one place to go to get replacements of those DME, because they left their house, they don't have it anymore, it's damaged, whatever, go straight to CMS. And these guides will tell you how and how to do that. But some people try to send them to FEMA and do other things. Send them to CMS, because that's where they can get the replacement for their DME during a disaster, if they are a CMS beneficiary. And the guides here cover that information. And that's it's relatively new. It's only a couple of years old, but a really good tool that helps. I do want to talk about prescription drugs. We have during disasters, we often open up the prescription drug line, essentially creating another avenue for people to get replacement drugs if they need it, or refill prescriptions for free. Free is nice. All right. Next, shift gears. We have this thing called ASPR TRACIE. And also one of my good friends, an old shipmate of mine, a Navy buddy, Shane Brannaman, created this. Shane is now retired and living life very happily, but she created this product, which I think is amazing. It is the clearinghouse of all information. So if there's material out there on any particular topic, you can probably find it there if you do the search. And more importantly, they'll create topics on the fly. So if there is a new strain of bird flu that's just coming out, they'll start assembling the resources, the subject matter experts, etc., and put together information on the fly so that it's available to the entire healthcare community. If you've not been to ASPR TRACIE, go there. It is truly the clearinghouse and storehouse of so much knowledge. that I use it all the time. When we just did the storms down in North Carolina and Florida, we tapped in our responders in and linked them into ASPR TRACIE sites that talked about some of the local hazards. You're going into this area in the mountains of North Carolina. Here's some things you need to know. And so we tied them into all of those different resources that are right there on ASPR TRACIE. So it is the provider of much knowledge. All right, let's have some fun. Let's talk about a handful of things. I had the honor and pleasure. It was actually good fun to sit down with a handful of healthcare organizations after a recent hurricane and just learn some of their best practices. And we're all in the same room. And it was great because as somebody said, oh, we did this. And I could see everybody writing notes and saying, wow, that's a great idea. We're going to adopt that. Again, steal liberally, steal from anyone you can for information on how to do things. And here's just a few things they did. I thought some of these were brilliant. One of the home care companies literally contracted with a tow truck because what they found is when their visiting nurses and techs were going out after a storm, they kept getting flat tires and they would get stuck. And you know how long it takes AAA to get there on a good day. During a storm, it was forever. So instead of seeing, 8 patients a day, they were seeing 1. And so they literally, the home care organization contracted with a tow truck to take care of their staff. They went out and fixed the flats of all the home care staff as they were trying to do visits, and they got them back on the road quickly. So it was a great idea. Other other organizations developed relationships with shelters. Frankly, it was like a hotel system. So they said, all right, you're going to set up a shelter. We have a pre-plan for this. You know where the shelter is going to be. You know who's going to run it. We want this secluded corner over here for all of our patients. So if any of their patients had to evacuate, they went to that already reserved section of the shelter. And they had another section where they put their staff and the staff's family. So if any of the staff had to leave their homes, they had a spot in the shelter reserved. What a great idea. So again, look at some of the things that I've done. One other organization, there are every state, some communities have at-risk registrations. One organization made it part of their intake. So as soon as you're doing an intake for a patient, you included the at-risk registration right there and walked them through it. Had a few benefits. 1, it got done. 2, it helped them with the language because language is tricky. If patient's family member says, oh, grandma's on a breathing machine, the at-risk registry doesn't understand it's a ventilator. So if you're there and making a part of your intake process, you can help them with the language, make sure they say the right thing. It is a BiPAP, it's a ventilator, it's an oxygen concentrator. So they legitimately get registered on the at-risk registrations. I mentioned this before, and that is if you can get a seat in an EOC or get the points of contact that you can call into. I'm sorry, I've been to Acronyms Anonymous. I'm trying to quit. EOC is Emergency Operations Center. But if you can get a point of contact where you can have that communication, they know you, they're expecting your call, that's beautiful. So develop those relationships whenever possible. One organization paid their staff early, which I thought was great. Storm's coming, your paycheck's not due till Friday. Here, I'm giving it to you on Monday because we know we're not going to have it. Supplies are a lot. So stock up on anything you can. If you can get a pre-delivery from your vendors before storm strikes, beautiful. Do it. Work with your folks, with your staff, and with your patients on that. Anything they can stock up on, any fuel, everybody knows. Fill up your gas tanks, etc. But if you can do those things, please do that. For storms, especially when earthquakes are hard, no notice. But if a storm usually gives you a few days notice, so when you have those notices, you should have that checklist. At 72 hours, at 48 hours, at 36 hours, we should be doing this. Checking your points of contact, making sure everybody's got the right phone numbers, that they haven't changed their phone number. Reinforcing the plans to make sure everybody knows if we're evacuating, hey, we're going here. And what's our redundant form of communication? power is a lot. So fuel, batteries, chargers, etc. If you can find ways to make sure that staff and patients have those, great. Just a little side note, the number one reason for emergency room visits in a disaster is lack of power. It really is. More people go to the emergency room just because they need a plug. They need an outlet. And so any way that you can facilitate making sure that people have a place where they can go for power, you can avoid a lot of stress on the rest of the healthcare system. Can't say enough about communication. There were organizations that found ways to make sure that their staff got access to fuel. Some communities already have designated points of distribution for fuel for first responders, healthcare workers. Make sure you know what those are in your area and make sure your staff can get there and make sure they have whatever ID credential they need to have to show, hey, I'm eligible. Please fill up my tank. And some places actually had fuel delivered, which I thought was brilliant as well. All right, what else can we talk about? Don't forget emotional support. It's really good to have some, the stress on your staff is just as much as the stress on your patients. So please have emotional support for both. Include some people who are good at that on your planning team, whether that's social workers, chaplains, people with emotional support animals. I worked this job for many years. I remember it was that 2017 hurricane season. And because we're here in DC, at FEMA, you'd had the president, the vice president, the congressmen, heads of agencies coming through all the time and shaking hands and thanking us for what we're doing. But we also had emotional support dogs coming through a couple of times a week. Guess which one was more important? I'd rather pet the puppy than meet the vice president. It was just true, and it made us all feel better. And it's just something not to forget about. It's good. All right, that's pretty much it. Remember, don't do this in a vacuum. You do not live on an island. Do this with everybody else in your community, or you're doing it wrong. Address the threats that are most prevalent and most likely to occur. Supplies are the biggest thing you're going to need. So make sure you know what your vendors' emergency plans are for delivery of supplies. Find other means to get supplies. Work with partners in unaffected areas. And like I said, develop that network and use it. Be ready. Plan those things. Exercise it. I didn't cover it enough on this one, but a lot of organizations spend a lot of time planning and developing their plan, and then they're getting ready to execute. They miss that whole step in the middle where you need to train it. Make sure you train your folks on your staff on the plans and your patients. Let your patients know what your emergency plan is so that they can help and participate and say, oh, if I leave from my home location and go somewhere else, I should let my healthcare provider know that I'm doing this because they reminded me of that's part of their plan. They may do it, they may not, but it's a higher likelihood that they're going to do it if you train them to do it and ask them to do it, make them part of your plan. And again, plan for flexibility. You'll certainly need it. It's a disaster. That's why they call them disasters. And I do believe that is the end. So, other than my gravelly voice, I hope I've passed on at least a few nuggets that you can think about, or maybe good ideas, and open for questions and discussion.
Well, I'm gonna start because I've been jotting down some things that you said. In terms of all hazards in our part of the world, I'm thinking yes, there's nuclear and of course hurricane, but we also have tornadoes. We have lots of refineries, especially along the river. Something that we never had to deal with before was drought, and we've had some seasons of drought in this area that have led to, believe it or not, wildfires, as well as communities along the Mississippi, saltwater intrusion, saltwater from the
Right.
Gulf coming up the Mississippi and cutting off water supplies. So those are all part of all hazards. Of course, there's pandemic, but I was also thinking in terms of we have not had this outside of a disaster, but just a regular power failure and cyber attacks that we've been hearing that there are forces that could cut in cyber attack to power plants and things like that. We also have Mississippi is a big threat. Could be a big threat in terms of like springtime flooding. We often see flooding along the Mississippi, over flooding, and also we actually have up in like the northeast side of Mississippi, we have a fault, the Madras fault, I think it is fault
New
line. So
Madrid,
they
New
get
Madrid, I know well.
New Madras, yes, and so they get some little rumbles up there. We've never had anything major, but the the world is constantly changing. And then I was also thinking as we're doing this, it doesn't have to be a community disaster, but your building could have a fire. You could be out of your building because of some sort of yeah, I saw yesterday on television a garbage truck explode. There are all sorts of things that can happen to an individual business that may not affect the entire community, but it's going to affect your business. And you were talking about how can you come back, how your resiliency, and then also there's workforce violence. Those things that are kind of the micro level disasters that can happen to us. Something that I really appreciate you saying that I had never thought about before, but we have lots of clubs, especially hunting clubs and fishing clubs and things like that, and finding one of those different clubs that might be able to support your efforts in reaching patients, either like you said, the three-wheeled all-terrain vehicle club that might be able to get your staff or patients to some important place, or a fishing club that has availability of boats. We have the Cajun Navy down here as well, but having that relationship with one of your local clubs, uh, you know that can count as volunteer. Those could count as volunteers for at least for hospices. I thought that was a neat thing. I do get regular Empower um, readings for Louisiana and Mississippi. So thank you for that. Um, yeah. Any other questions that were raised by folks that are on the call today? Or any comments you want to make?
Either I was very good or I put them all to sleep.
Well, Ted, I really appreciate your excellent presentation. Allison is the emergency manager in Baton Rouge and said thank you for your presentation.
Oh, great.
Ted, I really want to thank you, especially soldiering through this with COVID diagnosis. I hope that the Paxlovid is quick in responding to your illness, and that you're feeling much better before the holiday, the actual holidays start getting upon us. If there are no other questions for Mr. Kennedy, anybody?
Sir, I just want to say I would crawl over broken glass. A little thing like COVID is not going to stop me
Well,
from supporting any of your efforts at any time.
well,
I appreciate what you do and
well,
anything we can do to support it.
well, we appreciate you being available to us when we have these questions. The other thing that I learned today that I never realized is that DME, our patients' DME replacements should go directly through CMS.
Yeah, and
that
that's
will
all in
get
those guides that
quicker
were up on the screen.
replacements than trying to go through FEMA.
Yep.
I didn't realize that. So stick with and that's just a matter of going back to your DME supplier and having them reorder. Is that
Like I said, I know that's in the guides, but I have not committed those guides to memory. But
okay?
it does teach you exactly how to do that.
Well, if you wouldn't mind sending me your slides so that I can make those slides available to folks so that
Oh, absolutely.
they can click on those little hyperlinks and get to those guides and things like that, I would really appreciate it.
Can do. As
Thank you.
always, love to support your efforts and love all the work that everybody out there is doing
Thank you.
to support your patients.
We're
Thank you.
trying. We're trying. Um, no other questions? Hearing no other questions, we will say thank you again for being here, and we'll see you all next Wednesday at 1 o'clock.